Second one, next question, what is the probable diagnosis for a farmer who has a swollen foot? This particular farmer is having a swollen foot, right? And along with the swollen foot, he is also having multiple discharging sinuses are also there, right? And this image is given below. What is going to be your diagnosis? This is going to be what? This is a simple case of what? Is it a squamous cell carcinoma? No, carcinoma do not have the sinuses. Sinus means opening is not going to be there and nothing is going to come out. Chromoblastomycosis is a body lesion but without the sinus. This cannot be the answer. And sporotrichosis will be having what? Lymphocutaneous route of transmission will be there, right? So this is not going to be the thing. Here we are having what? Mycetoma, also known as Madurai foot, also known as Madurella foot, right? This is going to be mycetoma. This mycetoma can be of various type. We can have what? Actinomycetoma. We can have what? Eumycetoma. Sorry. We can have eumycetoma. Remember, this actinomycetoma is a bacterial. After E, there will be B. So this is a bacterial type of infection. Bacterial type of infection. And what are the organisms which are going to be responsible for this? Is going to be what? Nocardia. Remember, nocardia can cause this. It can be due to actinomadurai palatai, right? These are the organisms. Actinomycetes. This is going to cause what? This is a bacterial infection, which is also a mycetoma, right? Which is also going to cause mycetoma. But the discharge is going to define this illness. If the discharge is coming somewhat white or yellow, sometimes it can be red also. If we are talking about actinomadurai palatai, it can be red also. So if you are getting white, yellow or red discharge, this is going to be actinomycetoma. And the treatment depends on this particular thing, because if it is actinomycetoma, you can give the Welsh regimen. What is this Welsh regimen? They have asked in NEET PG, what is this Welsh regimen? You are going to give the combination of what? Trimethoprim plus sulfamethoxazole, right? It is also known as cotrimoxazole. This is also known as cotrimoxazole. You can give this cotrimoxazole here. This is going to be the Welsh regimen you are going to give in the cases of actinomycetoma, right? Whereas eumycetoma is going to be what? This is going to be fungal infection. After E, there will be F. So this is going to be due to fungus. And remember, fungus is going to give you black color granules are coming out. Black color discharge is going to be there. And when you have this black color discharge, you will appreciate this is going to be a eumycetoma. What is the treatment we are going to give? We are going to give what? Antifungals we are going to use. But generally, this fungal infections are going to be what? Painless, and they are going to be chronic, right? And that is the reason we are going to stay. The mainstay of treatment is not going to be this antifungals. Rather, we are going to add on something, right? We are going to give antifungals. If it is okay, that's fine. If it is not getting corrected, we need to go for what? Ultimately, you need to go for what? Amputation beta. This is important, because fungus, you just need to remember one thing. Bacterial infections are generally acute because they are painful. Fungal infections are going to be generally chronic. You have fungal infection, they are generally chronic because they are painless. Right? Pain is important. If you have pain, these infections are getting cured acutely. If you do not have pain, this is going to go for a longer period of time, and you can have what? You can have this fungal infections for a longer period of time, and ultimately you need to go for what? Amputation, right? So answer in this case is going to be what? This is a case of classical case of mycetoma that you can appreciate and you can identify very easily, right?